Chapter 4, Communication and Role of the Technician with the Customer Patient. The objectives at the beginning of the chapter will give you an idea of what you're going to learn and what you should know by the end of this chapter. Of course, at the beginning of the chapter, we have our terms and definitions. And we will cover those throughout the chapter. So probably one of the most prevalent concerns of pharmacy managers and pharmacists is the need for pharmacy technicians who are competent in the area of communication. Communication is the ability to express oneself in such a way that one is understood readily and clearly. Pharmacy technicians communicate daily with coworkers, healthcare professionals, and customers. Technicians are expected to use skills such as diplomacy, compassion, sensitivity, responsibility, tact, and patience. But communication is also important for patient safety. A technician who knows exactly what the patient needs and understands how to communicate is able to assist the person with confidence and accuracy. The communication cycle involves two or more individuals exchanging information. The cycle consists of a sender, a receiver, a message, various channels of communication, and feedback. The sender is the person who initiates the communication and sends the message across the channel. A channel can be written messages, spoken words, or body language. The receiver decodes the message and provides feedback according to his or her understanding of what is being communicated. To provide optimal patient care, pharmacy technicians must have a clear understanding of the communication cycle. So it kind of gives you a little diagram here to see exactly what they mean. Active listening is a communication technique in which listeners confirm understanding by restating or summarizing what they have heard in their own words. This helps both parties make sure the same thing is being discussed. Active listening helps keep the focus on the patient. Always remember the perception of the communicators when trying to convey a message. Showing empathy and listening are key components of ensuring the person that you are listening and are concerned about what they are saying. Olive. If a customer is angry about a medication, regardless of the problem, just listening can ease the person's frustration. Instead of talking over the person or telling the person that he or she is wrong, try to listen until the person is finished and empathize with the dilemma. Most customers know a problem with a medication is not the fault of the pharmacy technician, but they want to be heard. Professional does not allow himself or herself to be directed by another person's inappropriate behavior. Pharmacy technicians must remember to always behave professionally. So a lot of times, like it says, they just want to be heard. If there's an issue, they know it might be their doctor's office, they know it might be their insurance company, but you are the person on the receiving end, so they're going to vent their frustrations to you. Try not to take it personally and just let them vent and then show empathy. Like, I'm really sorry that this is happening to you. This is really terrible. Um, just trying to assure them that we understand and we hear them. Nonverbal communication or body language is the act of giving or exchanging information without using spoken words. Everyone communicates on a daily basis. However, rarely do we take a step back and evaluate how effectively we are communicating. The old phrase, actions speak louder than words, is so very true. When working closely with customers in the pharmacy setting or with coworkers, it is important that us as pharmacy technicians maintain a caring but professional attitude at all times, which can be difficult sometimes, and as in any profession. Most people make a judgment of others within the first 30 seconds of meeting. This is also true in the pharmacy setting. Professionals should not bring his or her outside problems to work. Stress manifests in various ways. So frowning, tensing your shoulders, biting your lips, raising your eyebrows, folding your arms, placing your hands on your hip. Other idiosyncrasies, rolling your eyes or sighing loudly, All of those things can give off the impression that you're impatient, that you don't have respect for the customer, that you're annoyed. Um, we want to make sure that our body language is welcoming to the patient. We don't want to seem closed off to where they don't want to ask us questions or ask us questions about their medication or things of that nature. So here's an example of body language, negative body language. So you see the arms crossed. Verbal communication is the sharing of information by individuals through the use of speech. It's obviously an important tool in pharmacy. It's a skill that we must learn and practice. To be an effective communicator, you must remember that your words and your voice are not always in agreement. Each is a separate entity and can be used to work for or against you. Remember that verbal communication has two parts, vocal and verbal. Your voice is a powerful tool that affects the customer or person to whom you are talking. Words alone do not necessarily convey your meanings or feelings. The inflection, which is the pitch, tone, speed, and volume, add multitudes of information that is being picked up by the listener. You can see some examples here of how this phrase can be misinterpreted. And here's some examples of how to improve your vocal communication skills. Words are also a strong tool. They can calm or escalate a situation between you and a customer or patient. Using intimidating words, belittling a person's opinion, or leaving the customer feeling embarrassed, angry, or sad may alienate the patient and may result in a loss of business. Be careful of the words you use while addressing a customer. If the customer is definitely wrong, do not tell the person that he or she is wrong. Instead, after carefully listening to the customer and listening fully, letting them get everything out, point out the misconception to let the customer know that you understand how this point could be easily confused. So sympathize with them, give them empathy, also give them the facts. So here's just some different examples. And here's some examples on how to improve your verbal skills. To optimize your communication, and the following are a few tips. Use open-ended questionings. This gets you more than just a yes or no answer. It shows the patient that the conversation is not just one way and that you care about his or her perspective. Provide empathetic responses. This shows the customer that you can see the situation from their point of view. When a patient thinks you understand how they feel, they are more inclined to share information that could assist with their health care. Minimize distraction. The goal for every conversation you have with a patient should be to communicate clearly and make sure your message is understood. If needed, take the patient to a quieter space, such as a designated counseling area, to answer any questions or clarify instructions. For example, you may have a patient who has received a prescription for tadalafil, which is Cialis. You ask if they'd like to speak with the pharmacist about their new medication. The patient is hesitant because there are several customers within hearing distance. You should suggest that the patient speak with the pharmacist in the counseling area, which is private and away from the customers. Another key area of communication in the pharmacy workplace is telephone interactions. And this is going to be something very important in pretty much every aspect of pharmacy, no matter if you work in hospital or retail or uh, for an insurance company or a home healthcare agency, you're going to use telephone etiquette. Etiquette is an unwritten guideline or rule of behavior. Both traditional phone and cell phone guidelines are discussed. Answering the phone in a busy pharmacy is traditionally the technician's job. Technicians conduct a great deal of daily business over the phone. The manner in which they answer the phone can set the tone for the remainder of the conversation. A professional attitude and good judgment should be used at all times. With each call, the technician must decide either to direct the call to the pharmacist or to handle the call themselves. Sometimes it's necessary to put a customer on hold. If you must, make sure you're checking back with the customer every 1 to 2 minutes to reassure that they are not forgotten and that you are um, working on their issue or looking for whoever they want to talk to. And box 4.2 is just some examples of unacceptable phone etiquette and just some guidelines when interacting with patients and medical personnel over the phone. So you're always going to want to clearly identify the place of your business, your name, and your title when you answer the phone. Carefully listen to the caller to determine the nature of the call. Determine whether the task is within your scope of practice as a technician or whether the call should be forwarded to the pharmacist. If the call can be handled by the technician, make an offer of assistance and restate the purpose of the call before placing the customer on hold or ending the conversation. Cell phone etiquette. Adult gadget ownership has increased significantly over the past few years. These devices have become a fixture in our daily lives. Mobile health apps are also popular, and patients are using these for lifestyle monitoring, test, and information gathering. So here's some different examples, and another one that maybe a lot of you probably are using is some type of watch that can regulate your heart rate, can do ECGs, can monitor your blood oxygen level, and things of that nature. Good cell phone etiquette is a must for today's pharmacy technicians. There are many ways that cell phones can distract them from delivering excellent customer care. Technicians must be careful not to talk or text on their cell phone while working. Even if you're looking up a drug or medication on your smartphone, it may give the patient the perception that you are focusing on something other than the task at hand. Resist the urge to check your messages or return calls until you're break. So I recommend not even bringing it with you into the pharmacy. Technicians have been terminated for inappropriate cell phone use while on the clock. If you have an emergency or an urgent message, ask your supervisor if you can step out for a moment to check on the call. Excellent patient care should always be your main focus. You cannot afford to be distracted when filling a prescription. And here's some guidelines for cell phone use in the pharmacy workplace. In today's workplace, pharmacy technicians must be proficient in written communication. They must also be able to document information, procedures, and actions accurately and clearly. The ability to coordinate written, oral, and electronic communications is vital to a successful pharmacy team. If the technician's writing is inaccurate or illegible, mistakes can be made and poor patient care can result. Technicians are responsible for written communication, such as memos, emails, and ordering supplies. Employees with good abilities come across as more capable and more credible than their coworkers who make spelling or grammatical errors. In the workplace, remember to proofread all written communications from emails to tweets to company memos. Just some more helpful hints and scenarios. The goal of communication should be to understand and to clearly be understood. The technician should be sensitive to each customer and alert to any special needs the patient might have. This role begins when the technician greets the patient and accepts the prescription. Special consideration should be given to patients who are terminally ill. Remember that they may be feeling overwhelmed. Although each person copes with his or her own mortality different, there are normal progressive steps that people experience. The 5 stages that terminally ill patients experience are as follows. So, denial, this can't be happening. Anger, it isn't fair. I don't deserve this. Bargaining, please make me better and I promise. Depression, I will never be able to see you again. Acceptance, I can do this. Everyone does. Normally, the first stage is denial. This is a defense mechanism in which the situation does not seem real. Perhaps the reality is too harsh for the person to accept. The next stage is anger. Sometimes one may have a feeling of unfairness. Bargaining usually follows anger. The person makes promises to himself or herself or to a higher power in the hope of a miracle. Depression can take over at this point with the realization that nothing is going to change concerning the prognosis. The final phase is acceptance, in which the person concedes his or her own mortality and prepares for eventual death. Each of these stages can manifest at any time and last for different lengths of time. Therefore, it is important that the technician be compassionate to the patient's situation. Most healthcare workers do not hesitate to help a dying patient. However, the problem is how to identify these patients. Unfortunately, unless the patient decides to share this information, the pharmacy does not necessarily know. Some medications indicate an advanced medical condition. These include pain medications such as fentanyl patches or morphine. However, these drugs do not definitively identify a fatal condition. Therefore, the pharmacy technician must be objective about each person who enters the pharmacy and realize that he or she does not know what each person is experiencing. We live in a culturally diverse society, and technicians often encounter customers who do not speak English as their first language. Technicians who speak multiple languages are in high demand and can play an important role of the pharmacy team. Approximately 48 million Americans have hearing loss. An estimated 1 in 3 cases is caused by excessive noise exposure. 1 in 5 American teens has the same degree of hearing loss found in adults 50 to 60 years old. Considering these statistics, there's a high possibility the pharmacy technician will encounter a hearing impaired patient. Therefore, it is important to be aware of any special needs the patient might have as the person approaches the pharmacy counter. When dealing with these customers, you might ask how they prefer to communicate. So if you want to ask them to write out the questions, or some might only know sign language, um, things of that nature. Remember, the pharmacy technician treats people equally regardless of their disposition. The technician is behaving appropriately and professionally. The pharmacy technician can influence the development of a positive atmosphere in the pharmacy setting by maintaining an appropriate attitude. Attitude is a mental disposition or feeling a technician adopts towards customers, coworkers, or duties at work. Allowing customers to express frustration, being a good listener, and doing one's best to help others are important components of acting professionally. Today, the pharmacy technician is an important member of the healthcare team. In the retail setting, the team may consist of the technician, the pharmacist, the pharmacy manager, counter personnel, and other store employees. In an institutional setting, the team can include technicians, pharmacists, and managers, physicians, nurses, and other departmental personnel. In all pharmacy settings, teams work to provide the best care possible for patients. The team leadership establishes clear expectations for each member's responsibility. Trust and communication are key components of a successful team. And here are a few tips to help you become an effective team player. Effective communication is challenging in today's workplace. As discussed earlier, there can be many barriers, such as those involving language differences and hearing impairment. The first step in eliminating these barriers is to recognize that they exist. Then it's the responsibility of each team member to be knowledgeable about the techniques used to overcome these obstacles. We live in the information age and have access to many devices that help us communicate. However, much of this information exchange lacks real meaning. Real communication occurs when both the speaker and the listener are fully engaged. The best defense against any communication barrier is a strong cooperative team. When serving patients, technicians should give each person their undivided attention. They should provide all customers with the opportunity to ask questions. Verification of understanding is needed for optimal compliance and patient safety. Technicians should strive to really hear and understand each individual. Effective communication can increase adherence to treatment and decrease adverse effects, which ultimately lead to improved healthcare and safer patient care.